Good morning. I want to thank you all for joining us here today. This is our second webinar in a series of 5 webinars on emerging infectious diseases. And I am Peter Chernak, Executive Vice President of the Home Care Association of New York State. I'm thrilled to be here this morning with our colleagues from IPRO, who are the partners in our work around this emerging infectious disease and high risk infections and home and community based care. We're really looking at building sector wide preparedness in this critical area. And I'm very thrilled that you're all joining us here today and look forward to your participation as we move forward in our training series. So if I can simply introduce, and I would like to extend greetings from our president at HCA, Al Cardillo, who is not able to be with us in person this morning, and to introduce as well, who are present in the webinar uh, this morning, Sarah Butterfield with IPRO, and I don't know if Terry is with us as well, who presented last month. Um, I'll be introducing our speaker in just a few moments, but also want to recognize and to thank Fidel Emery Monroe. Fidel has been a absolute wonderful uh, source of guidance and support in preparing these important preparing for preparedness. Fidel is the senior program manager for long-term care at the Bureau of Healthcare and Community Readiness at the Office of Emergency Preparedness and Response, New York City Department of Health and Mental Hygiene, and a great partner to us here at the HCA and to our efforts around emergency preparedness in New York City. We're pleased to partner with IPRO, as I had said, and I'm very excited to introduce our speaker. And I don't want to take up a tremendous amount of time, and I do want to recognize the excellent work that Melanie Ronda does in her position at IPRO. You'll have an opportunity, I think, to ask some questions as we move forward in the webinar at the end, if there is time. But if there's not time, I encourage you to um, put in the chat any questions that you have, and we will prepare an FAQ response that we'll send out to all participants after the webinar. We'll also share with you the slides to the webinar. And I would want to ask you, please, to stick around for a couple of moments at the conclusion to complete our evaluation, which will come up on your screen when you exit the webinar. So without any further ado, let me just turn this over to Melanie, and thank you very much for coming. We're looking forward to a great program this morning. Melanie.
Thank you. Thank you, Peter. All right, so please use chat for questions throughout the program, but let's get started. So our learning objectives today, we're going to review elements emergency preparedness and response policies and procedures to manage outbreak response, discuss community relationships to enhance emergency response and reaction, review workforce planning strategies for infection prevention and control for high risk and re-emerging prevalent infections. Next slide, please. So Terry Lebowski, who spoke last month, really went in depth with some respiratory viruses. I wanted to reintroduce those, have some conversation about it because it's really important when we're talking about outbreak response. It's important to understand the transmission and the spread. So let's start with RSV, so respiratory syncytial virus. RSV causes and spread, and I am going to go through the slides because the more we talk about this, the more we'll remember it, is RSV is very contagious. We know this. We saw it very frequently in children in the past, but it also is a problem for our elders. It can be spread by contact with fluids from an infected person's nose and mouth. This can happen by inhaling the droplets of a person's cough or sneeze or by touching contaminated surfaces. So, really important to be considering this, right? So, it's coughing, sneezing, or the environment. Outbreaks often occur in classrooms, community centers, child care centers. So, the people you're serving, where do they go? And are in community areas. So think about that. In most cases, people with RSV are contagious from 3 to 8 days after their first exposure. So that is also a clue. Think about that. However, an infant or somebody with a weak immune system, so how many people do you serve that have a weak immune system, contracts the disease, they may be contagious up to 4 weeks. So, also a big consideration. RSV can live for many hours on hard surfaces like tables and cribs, but it does not last as long on soft surfaces. Next slide. COVID-19, another respiratory concern that we have. COVID-19 is the disease, and SARS-CoV-2 is the RNA virus. One of our challenges with COVID-19 is that it is a virus and it does mutate, and we got different strains. So certainly each year we're seeing some different pathogens. It's established as a year-round respiratory pathogen. Another challenge, it's not seasonal, it is year-round. The evolution of the viral variant and subvariants has slowed due to human immunity globally, which is good from our initial impact. New variants are expected to continue to emerge. So, as we know, viruses do have this tendency to emerge and mutate, and we have new strains. And the Omicron variant is 50 to 70% more transmissible than early variants. So, next slide, please. So again, we want to talk about spread. We want to talk about transmission when we're thinking about outbreak management. COVID-19 spreads when an infected person breathes out droplets and small particles that contain the virus. Other people can breathe in the droplets or particles, and the droplets can land on others' eyes, nose, and mouth, and droplets may also contaminate the surfaces they touch. The virus can live in common surfaces. The time differs by the type of surface: glass, 5 days; wood, 4 days; plastic, 3 days, which is huge. That's a big problem in outbreak management. Cardboard, 1 day, as an example. The amount of virus on the surface may or may not infect you. Anyone infected with COVID-19 can spread it, even if they do not have symptoms. And next slide. Let's talk a bit about influenza. So, influenza is caused by an infection of the respiratory tract. So, again, a respiratory virus. And there are four classifications: type A, B, C, and D. Influenza A and B are commonly caused illnesses in humans in seasonal epidemics. Traditionally, we see influenza A, and then we move throughout the season to influenza B. Its seasonal influenza activity remains elevated nationally. So influenza A is decreasing while influenza B is increasing. As I said, that's what we typically see in an influenza season. So influenza A, H3N2 viruses are the most frequently reported influenza virus this season. And among the H3N2 virus collected since September 2025, that completed genetic categorization, 92% belong to the subclade K. And that's the reason why we had such a strong influenza season, because it was a new subclade K. No new avian influenza AH5 infections were reported to the CDC during last month. So, next slide, please. And now we want to talk about the sporadic avian influenza A, H5N1. Also, some people know it as bird flu. There has been concern that this could mutate and become transmissible person to person, but as of right now, the virus infection from people it has been reported worldwide, and the outbreaks are occurring with poultry and dairy cows. The primary reservoir is wild birds, but influenza A virus are also common in domestic poultry and swine population. Human infection with H5N1 have occurred since 2022, primarily due to direct or close exposure to infected poultry or dairy cows. So not from person to person as of yet. People with close or prolonged contact with infected animals or contaminated environments are at greater risk for infection. Risk to the general population currently is low. Next slide. So this is a nice summary, and again, this is building on Teresa's slides from last time, national summary statistics, and no person-to-person spread. So we'll go to the next slide. An avian influenza may spread in a few ways: direct contact between infected birds and other animals, from contact with virus contaminated environments or animal byproducts, avian influenza A through the air droplets or dust. Very rare, limited person to person spread has occurred in other countries. Next slide. And then the transmission for H5N1 transmission, the time from exposure and infection to presentation of symptoms ranges from 2 to 5 days. Again, an important timeline. The eye symptoms, redness, irritation, can occur 1 to 2 days after exposure and infection. CDC reports that patients are most contagious during the first few days of illness. People with severe disease require hospitalization. Duration of illness is usually 2 weeks. And next slide, please. So here is just a quick review slide, and this will be helpful for you to keep and use. And it talks about transmission, the symptoms, and time from exposure to infection on the respiratory viruses. So next slide. I like this slide because it does show when somebody coughs or sneezes the impact of how things spread. So this is what you need to be considering when you're serving your clients and you're going out into the homes. You're going to if you're in a group home, that this is if somebody's sitting within that 3 feet, they're likely to become contaminated if somebody is ill. So next slide. So now we're going to start moving. Now we did the review. We understand the impact of transmission and how bad respiratory viruses can spread throughout the community, how quickly that can happen, the fact that you can be contagious for 7 days before you even realize how sick you are. And that is why we have this problem with the spread. What I wanted you also to know is that we have federal ways of determining what is happening in our country from emerging pathogens and state trends as well. So next slide is our federal emerging infections program. So the CDC does monitor emerging infectious diseases through surveillance networks. It collects data to detect new pathogens and outbreak trends. That's when we start to realize something different's happening. We may realize we have a different flu strain this year because of these data collection. It supports research, prevention strategies, and public health response. The CDC collaborates with state health departments and laboratories, and they provide information that guides policies, preparedness planning, and clinical practices. And there is a link that we provided on these slides so that you can kind of review what's emerging and whatnot. Next slide. And here's an example of how you could pull a report for the community viral activity levels in New York right now for respiratory illness data channels. So you'll also have this link. This is helpful for you to realize what's going on in our state, and you can get to the community viral activity map as well. So if you're starting to get some increased call-ins, go out and check and see what's going on with COVID, flu, and RSV. So when I accessed this on March 13th, so in New York State, COVID was low, flu was limited, and RSV was limited as well. Next slide. And then we have the ability to know what's happening at a state level. And this is a nice page I wanted to show you so you can learn a little bit more about what's going on with emerging infections at the state level with a lot of different choices. So you can look at foodborne disease. That's information you might need. Influenza hospitalizations, RSV hospitalizations important, COVID and Lyme might impact you, the people that you serve. So it's something to be aware of, and healthcare associated infections as a whole. Next slide. Also, I wanted to just mention that the Wadsworth Center is near Albany, and it is the state lab that really can dive into the details and often is the way we learn about new and emerging pathogens in New York State. Next slide. So why are we talking all about all of this, right? So we are going to talk about how are you going to plan for outbreak management, and you need to know what you're looking for, and you need to know how you're going to know when something is occurring in your community. So we're laying the groundwork. So let's get to the next slide. We're going to talk about regulation. So follow CDC, CMS, state and local public health requirements. So you need to follow what regulations guide your agency. Ensure compliance with infection prevention and control standards. So no matter where you're working in healthcare, there is standards around infection prevention and control, such as hand hygiene, PPE usage, prevention, such as vaccines. Maintain reporting procedures for communicable diseases. That's we have to make sure we're reporting as we identify things and identify infections. Align agency emergency preparedness plans with federal and state regulation. Very important that you're partnering with your communities and learning what's happening from EP planning at your community level. So you're part of the solution if something happens. Monitor regulatory updates during emerging pathogen and disease events. Next slide. So now we've really laid the groundwork to what are you going to do? Now we're going to talk about what are you doing in your agencies? How are you going to make a difference? And the first thing that you really need to do is a good hazardous vulnerability assessment. What that is a systematic risk assessment tool used by organizations to identify, analyze, and prioritize emergencies that could realistically affect the area and the people that you serve. It's a foundational element of emergency preparedness. Identifying biological hazards and infectious disease risks, assess potential impact on patients, staff, and operations, evaluate likelihood and severity of outbreak scenarios, prioritize planning for high-risk infectious threats, and update assessments regularly to reflect new and emerging pathogens. I'm hoping, and you can also put in chat, do you currently use a hazardous vulnerability assessment? Is this something you've done with your teams? Let's talk a little bit more about it. Next slide. Here I have an example of one, and I'm going to talk a little bit about this. An HVA helps organize answers for 4 critical questions. What could happen? So, what could happen in your area? How likely is it to happen? How bad would the impact be for you, for the teams that you work, and for residents. What should we prepare for first? So this lays it all out on what is going to be the most important thing for you to be doing with what is likely to happen. An HVA uses an all hazards approach, meaning it looks broadly at threats such as natural hazards, severe weather, flooding, extreme temperatures, um, technical hazards, power failure. What happens if you're going to visit someone who has no power and they need something that requires power? How are you managing that? Human cause hazards. Like a terrorist event, biological hazards, like we're talking about an infectious disease outbreak, like avian influenza. How would we manage that? And it analyzes vulnerabilities. The assessment looks at a facility specific weakness or your area weakness, including um, who you are serving and the mobility and movement. How could you move them from their home to a different area? If you're working with in a group home, what would you do with your clients that live there? Staffing and resource limitation, operational dependencies. Do you have a way to communicate to everyone? Prioritizing and planning and mitigation by ranking hazards and vulnerability. The HVA helps leadership focus preparedness efforts, target mitigation strategies. So, what's your backup? How are you going to manage this? If with this event occurs, if you have a blizzard and you can't get to your clients, what are you going to do? How are you going to get to those patients? Well, what is your mitigation strategy? Can you prioritize your patients? It guides your emergency operational plan. HAV directly informs your emergency response procedures, continuity of operations, training, and exercises. And it should be reviewed at least annually. So hopefully, I do see that there's some chat popping up. Hopefully, if you do have an HVA, that you are reviewing this annually just to see some risks and trends. I certainly have known, we've seen some different weather than we always see here, right? So being aware of weather changes, I know New York City has had a lot more snow than you may normally receive. So were you prepared for that? Is that something you need to put on your plan now? How are you going to manage that type of situation? Next slide, please. And then when you do your HVA, it should not be a one person approach. This should be thorough. You want to incorporate a team, bring the data, bring in your what I already provided to you. So I laid that what's happening on a federal level, what's happening on a state level. Can you bring a community member into this conversation? Can you bring your EMTs into this conversation to see what's happening? Your local response teams. Understand the community and state risks and don't rush. Really thoroughly go through your HVA. Next slide. Here are some examples for consideration. Again, climate and weather, natural disaster, infrastructure. Next slide. Now that you've worked through a hazardous vulnerability assessment, it's really important that you pull in what your policies and procedures look like. Review and update your prevention and control policies if it's appropriate. What are you going to do if you have shortages? How are you going to manage your staffing? What if you have people that are ill? Ensure procedures address emerging infectious diseases, include isolation precaution and outbreak response protocols, align policies with current CDC and public health guidance. So make sure you're familiar with your CDC website when we're talking about infection prevention and control. There's the Association for Infection Prevention and Control, so it's APIC. Look at apic.org. Go to your Department of Health, go to New York City Department of Health, look for information that you need to be able to do your job in the event of an outbreak. Align policies with what is happening at a federal and state. Communicate updates to all staff and leadership. We're going to talk a little bit more about communication in a minute. So, workforce planning. Sorry, next slide. Next slide. Workforce planning. So, this is really a difficult situation to talk about workforce planning, but staffing strategy for outbreak and surge situation, home care agencies must plan for shortages, increasing demand, and serve prioritizations during outbreaks. Identify essential services. So somehow you need to lay out what is your essential services that must continue during an outbreak: skilled nursing visits, medication management, wound care. Develop surge staffing strategies to respond to increased patient needs or reduce workforce availability. Establish minimum staffing thresholds required to maintain safe operations. Cross train those that you can to maintain operations when staffing levels fluctuate. Cross train staff to perform critical functions outside their usual role. So maybe you have an education nurse, but make sure that education nurse would also be able to go into the field and do wound care if that was appropriate. Identify alternative staff who can assume essential duties if primary staff are unavailable. Maintain documentation of staff competencies in scope and limitations. So, do you know what your staff are trained on? Do you understand what their past experiences are, where you could pull them in case of a crisis? So, staffing contingency plan. The workforce plan must account for staff illness, which is a real challenge, exposure. We saw during COVID-19 that quarantine period or isolation. Anticipate absenteeism during community outbreaks. Redeploy the redeployment of staff to higher priority patients. So know who you're serving and always be aware of who could you see tomorrow, but who must you see today. Required action: develop contingency staffing plans to address short-term and prolonged workforce disruption, aligning staffing decisions with infection prevention and control policies. Infection prevention and training and competency, staff must be prepared, right? So this is very important that your staff are prepared to safely deliver care during outbreaks. Ensure all staff are trained in infection prevention practices, including standard and transmission-based precautions. Proper use of PPE. Do your staff actually know the proper way of donning and doffing? Is there a way to maintain clean environment if you're walking into a house where somebody's coughing and sneezing? Are you able to reinforce the knowledge on a regular basis on how to manage infection control concerns? And especially to enhance infection control concerns during outbreaks. Do you provide to your staff something to clean down, a wipe that they could clean down a table or an area where they are going to put their things and put a barrier down? All very important things in an outbreak. Um, Encourage staff to maintain. Another area we can work on is staff preparedness and availability. So, home care agencies should support staff readiness. So, encouraging your staff to maintain personal and family emergency plans. If that's not something you've considered, it might be a nice training event for your staff. Implementing a rapid staffing assessment process at the onset of an outbreak to determine workforce availability. Do you have the entire list of your staff that you can quickly call or somehow contact to know who's available, who can do what, who is the closest person to your patient that you need to go see? Do you need to shift around things because it's impossible for someone to get that far, or there's a flood, or a blizzard, and someone can walk to that area where another person wouldn't be able to drive to that area? Maintaining updated staff contact lists for rapid communication. How often are you checking your communication lists on multiple? Is there a new cell phone? Is there a new email? Many staff change out cell phone numbers. Are you ensured that that you have the most up-to-date contact for your staff? And then communication and coordination. Effective workforce management during outbreaks depends on clear internal communication regarding staffing expectation and changes, coordinating with public health, emergency preparedness partners, and community resources, ongoing updates to staff as outbreaks evolve. So being very forward with your staff and making sure they know what's going on. Next slide, please. So your staff should be included in EP training should be included in orientation, outbreak management. We certainly have been going through with COVID-19. It became a real concern. We've recognized how a pandemic can impact us, but let's not lose that momentum of being aware of EP planning, making sure it's part of orientation. We're establishing a regular training with staff on EP. We compile and maintain that current list of staff emergencies, and we create protocols for communication in emergencies with supervisors. Next slide. We want to be educating for outbreak management. So provide staff education on emerging infectious diseases. So as you learn about something, you're letting them know we want to be checking to know influenza's on the rise. Let your staff know that so that they can be prepared. They can be implementing their family plans. They may choose to wear masks. They may choose to go get their influenza vaccine because influenza is on the rise. Whatever it is that is happening in your community, it's important that you're a conduit to get that message to your staff. Reinforce hand hygiene infection prevention practices. Now, when we're going into someone's home, there's so many different environments that they may become exposed to. Make sure you're doing scenario-based training with your staff. If you're walking into a facility or to a patient's home and there's cats climbing on the stands and you're trying to prepare to do a dressing change, how do you manage that? And how are you making sure everything remains clean before you change that dressing? Train your staff on PPE use and isolation precautions. So if you are going into a home that someone is ill, how are you donning and doffing, removing, and making sure you're walking out of that home as clean as possible and disposing of waste before you're getting into your vehicle or a taxi or walking into your next home? Educate patients and caregivers on disease prevention. So, this is a really important point that you may be the only people seeing your patients, and how are you talking about prevention? So, this would be important that you do talk about wearing masks, alerting your caregivers if you're feeling sick, if you have cold, if you've been exposed, right? So, oh, this weekend my family was over and they left and on Monday they have COVID. Teaching your patients that, in fact, let us know that you've been exposed to COVID or influenza or RSV so that our staff can wear masks and prevent this future spread. Update training as new guidelines or threats emerge. So we certainly saw that during COVID-19 that there was a lot of information coming at us very quickly. So how are we getting that communication out? And if it were avian influenza that did mutate and we were had that spread, there would be a lot of information coming out again quickly. How are we going to make sure the information is getting to our staff when as quickly as it needs to? Next slide, please. Um, So here are a few training resources I just wanted to put out there that could be helpful. Emergency prep, what we do, New York City Department of Health. Project First Line, if you've not used Project First Line, there is a lot of resources embedded in Project First Line around infection prevention and control, and some good training material you can use with your staff, and items that you could use with your clients and patients as well. And we learned, we were working on a Project First Line uh, project, and we did an assessment. And one thing we actually did hear from providers in the home care setting is donning and doffing. They learned how to do it, but there was some opportunity to improve on that and when to soap and water wash their hands and when to alcohol-based hand rub wash their hands. So that was interesting. And so it just kind of brings back that we do need to be doing formal training with donning and doffing and hand hygiene as well. So next slide. So let's talk a little bit about communication and planning for communication. Next slide. Um, so it's important that you maintain a written emergency communication plan to ensure timely, accurate, and consistent communication with staff, patient, caregivers, family, public health authorities, and emergency partners in your area during outbreaks and other emergencies. So it's not just outbreak management, but in any emergency. This plan is integrated into the agency emergency preparedness and infection control program. The communication plan supports the continuity of home care services during emergencies, rapid dissemination of outbreak related information, and coordination with internal and external partners. So it's for both, right? So that's important. Internal communication with your staff. The agency will maintain a current staff emergency contact list, which we talked about, reviewed and updated regularly. So that's something I don't know, maybe you have an opportunity to look at that practice and policy. How often are you updating your emergency list? Establish clear protocols for staff notification during emergencies and outbreaks. Communicate staffing expectation, infection prevention guidance, and operational changes. Provide regular updates using multiple communication methods. So you want to be cautious that you don't just decide on one path when it comes to communication, because in case of an event, it might be challenging to use a specific one way. You need multiple. Staff receive education on emergency preparedness procedures, outbreak specific communication expectations, how and when to report concerns or changes and availability. So, do they know how to report to you changes? During an outbreak or emergency, the agency should notify their patients and caregivers of changes in service. So that's another element. So now you're in an outbreak, things have to happen. How are you going to notify the loved ones or the patients that something different is going to be occurring, changes in service visit schedules or care delivery? Provide clear instructions related to infection prevention. So you also might be the only person that's going to be speaking to them. So also give them education. So yes, your service is going to be changing because of this, this, and this, but we also want you to be aware this is what's emerging in the community. Here are some symptom monitoring, and this is when you need to seek medical care. Encourage patients and household members and family and household members to also have a communication plan in place. Ensure emergency contact information is current. So again, that emergency contact information isn't just for your staff. You want that for your patients and family members. And making sure your communication is clear, timely, culturally appropriate, and accessible, and update as conditions and guidance change. The external communication and coordination, the agency should coordinate communications with your local and state public health departments. Make sure you know who you should be talking to. So do that before the event. Who is it at your local health department, and who is it at your state health department you should be communicating with? Who are your emergency management agencies? Do you know who they are? Do you know who you should be talking to? Also, your healthcare partners and referral sources. Report outbreaks and other reportable events as required. Share situational updates related to staffing, service capacity, and patient safety. Align messaging with public health guidance and regulatory expectations. Next slide, please. And I think we really learned a lot about trust and credibility with messaging during the pandemic. Be ready to combat misinformation. If this is an emerging pathogen, be ready to manage that misinformation that your staff is hearing on Facebook, right? Facebook, social media, it's wonderful, but also it was quite a challenge often too. So lead with empathy and caring, be honest and open, establish competence and expertise, and decide who will be communicating to staff, families, and patients. Next slide. So supplies. So supplies are really important. It's important to be considering what do you need, maintain adequate PPE. Do your staff regularly have access to PPE, especially those that are on the road? How often are they able to um, fill a bag? When do they get more? How are you managing that? If that's not something you've already considered and thought about, it's something to start thinking about right now. How do you boost up your supply chain? How do you make it available? And how do you get it to the frontline staff? Ensure access to testing supplies and disinfectants. So, do they have some sort of disinfectant that they have available that they can use in the homes? Monitor supply levels and establish emergency stockpiles. How are you? When do they alert you that they need to get more supplies, and how do they do that? Often we write a policy and we assume everyone understands it and knows it, but it doesn't work all, it doesn't go all the way to the person who's at the bedside, that's actually walking into the house. So assure yourself that that's actually happening. And then additionally, you want to make sure you have alternative vendors. If you only normally order, and I don't know, one box of gowns a month, in the event of an emergency or an outbreak, you may very well need 15 boxes a month. And how would you get that if all the hospitals and the nursing homes and other people are looking for the same product? So having that alternative vendor and supply chain options is important. Maybe you work with your local hospital to see, in case of an emergency, would I be able to get some supplies for you? Just ideas to get out there, and ensure availability of infection control equipment. Next slide. And we talk next, yeah, tabletop and drills. So here we're talking about we've kind of laid the framework of looking at our hazardous vulnerability, doing our policies and procedures, communication, getting involved with your community. It's important to do some tabletop drills. So conduct infectious disease outbreak scenarios. How are you going to manage it? So for you, you may want to do a tabletop drill on what you're going to do within your organization, but then you want to expand it on how you would do that with a group of people in your community. Test agency emergency response plans. So, like I said, often we believe we have a great policy. We know how this is going to work. This is great, but we'll get to the level of the staff, find out if what you say is happening or what you believe to be true, is it really true? Identify gaps in your communication and staffing and resources. Maybe pull your list today of your staff and then just put a test out, see if it works. Maybe you need to identify a new procedure. Maybe you need some updated contacts. And even maybe getting updated contacts is a challenge. How are you going to do that better? Engage leadership and frontline staff in preparedness exercises. use results to improve policies and response strategies. So once you've done this, you're going to see some opportunities to enhance your policies, your procedures. Maybe it's staff knowledge, maybe it's community knowledge, but then the next action is to improve them. And then I would definitely want you to join your community drills. So if anything is happening in your community, um, join the drills. Next slide. I added some references for emergency preparedness references, so that's available to you as well. And we do have time. Next slide. So we do have some
And,
time for questions and feedback.
and Melanie, it's Sarah, and we have a lot of responses in chat to share with you. We have quite a few folks that are doing a yearly HVA. And Barbara shared that they completed collaboratively with the management team, a contracted person who is an MEP, CHEP, form an incident management solutions company. So they have a very collaborative approach. And Ruth has shared that they have an HVA worksheet that automatically calculates a risk score for each element. And it's completed by collaborating with all departments. Um, I love this. They have a pet policy, which I'm sure many of the agencies do, for pets wanting to be part of the care. It requires the pet to be confined away from care, which is so awesome. And they
That's
discuss that with the
great.
family prior
Yeah,
to. So that's
that's a
awesome. And I just want to note that Ruth actually shared the link to the Asper Tracy site for that worksheet with everyone.
oh, fantastic.
Yes.
That's great. I
Thank you
love the
so
pet
much.
policy. Do others have a pet policy like that? So it's discussed like on as a new patient to you?
Yeah, that's an excellent idea.
Is it all right if I answer that?
Sure.
Sure.
Yeah, it's something that is part of our admission process that we discuss. We had one, but then we had to strengthen it because we had a couple of staff have either attacks occurred that didn't result in injury. That was mainly by dogs, or we had two staff that got bitten. Um, and had to be followed up. So we strengthened that policy and said, absolutely, this has to be addressed prior to every visit, that pets need to be confined away from the area of care. If it's a ADA, a dog that's
Mm,
needed or an animal that's needed for support, we treat that a little differently, but we request that all pets be confined during our care.
Thank you.
thank you. That's helpful in a variety, but obviously keeping your staff safe, but also it really will reduce that likelihood of the contamination of anything that you're doing. That's really
My
nice.
background's in infection control, and we don't want the cats helping with dressing changes.
No, definitely not.
We have the same policy as well,
Excellent.
that
Or,
animals have
or,
to
yeah,
be taken out of the room.
right. Or wound cleansing anyway, right?
Thank you
Yeah,
for
when
sharing.
animals don't realize that what you're doing is helping their person. They don't get it. And it's also an infection control thing. You don't want all that hair in their business.
Yeah.
Absolutely. Good to know. So those of you that are doing the hazardous vulnerability assessment, I see, have you had any challenges to really getting down into the nitty-gritty to create your policies off of it?
This is Ruth, not so much anymore because we've been doing it since 2017. but we've added elements. I mean, for instance, we added specifically COVID back in 2020, but in the last 2 years ago, we added cybersecurity and drilling down on that and making sure all aspects are covered, even for a small agency like ours, has its challenges to make sure that we have the proper protections in place for our data.
That is a great point. Cybersecurity, I would suspect, might not be on a lot of these pre-created documents. So I like that you pointed that out, something for others to consider. Have you added cybersecurity to your HVA? Thank you. And I do think the first couple times you really walk through and do a comprehensive HVA, it's a little awkward, but as you get more familiar and you get more team members doing it, you can really dive in and get a good product and create then some policies and procedures that really enhance your program. Are there any questions? Well, I hope that you all take away something from today's conversation and can go back and use it and maybe make sure we have a good communication plan because that seems to be one of the hardest things that we can accomplish is a good communication plan to our staff and our families and our community.
Do we have to register for each one of these? I missed the first one, so thank you for sending. I know you're planning on sending the webinar out, and I appreciate that. Or do these all have to be registered for individually, or can we register as a group on the website?
Individual registrations is preferred for each session.
Thank you. Thank you. And this has been really great and helpful to me. Thank you so much.
And thank you so much for asking about that webinar. I don't know if you saw in the chat that we will also send out the slide deck from the PDF of the slides from our first webinar, and obviously for today's as well after today's session. Is this a good time to do a little previewing of the series? I see you have the what's next slide up. So we're real excited about the participation and the quality of these presentations. And in moving forward to really broaden and deepen the knowledge that we've been discussing. This is, we are accommodating folks participating in the webinars individually, but really taking advantage of the entire series is, I think, most helpful. So please do take a look at the dates. We'll be sending out a flyer to all the folks who participated in the webinars and to our broadest distribution as well. So mark your calendars. Other questions? We have about 3 or 4 minutes. Well, I think I'm just going to then share that first of all, completing a webinar on time is often a function of how really well delivered the material has been. I have to thank you so much, Melanie, for providing us with such really important and in some cases complex information presented with such clarity and accessibility. It really has been a wonderful learning experience. And I want to recognize that and share with folks that we're really, again, looking to support and strengthen sector-wide preparedness in home and community-based services around this critical issue. And look forward to having conversations, dialogues with you as well about your experience in this regard in terms of our trainings and this overall programming and ideas that you might have as we advance in this effort together. So thank you again, Melanie and the team at IPRO. And please take a look at the evaluation on your way out and take a few minutes to complete that. It'd be most helpful to us. So thank you,
Thank you
everyone.
all.